As protests continue and more coronavirus restrictions are being lifted around the country, roughly half of all U.S. states are reporting either steady or increasing rates of new COVID-19 cases, with 14 states reaching record highs. And now there are reports that more than half of the states might be underreporting case rates and deaths because they're not including probable cases, as the CDC guidelines say they should. That means the U.S. total, now nearing 2 million cases, according to Johns Hopkins, might really be a whole lot higher. And somehow it's once again up for debate how easily the virus can spread after a World Health Organization official said yesterday that it was, quote, extremely rare that an asymptomatic person has passed on coronavirus to another person, which runs contrary to what almost every other public health official has been saying. So today, she offered a clarification of sorts.
I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies.
She also said there's still much unknown. But I'd argue Harvard Global Health Dr. Ashish Jha offered the better clarification when he joined us last night.
The best data out there says 40 to 60% of infections happen from people when they are asymptomatic. So it's not rare at all. Some people, remember, will always be asymptomatic. They'll develop the infection, never develop symptoms. A lot of people are what I call pre-symptomatic, what we call pre-symptomatic. They will pass the infection on when they don't have symptoms, but later go on to develop symptoms.
So in short, my money's on not all that rare. All that said, here in Massachusetts, case rates have been trending down overall. And to keep it that way, Governor Charlie Baker has been rolling out strict restrictions on many industries as they get to reopen. Among them, daycares, many of which are now trying to figure out when and if they can afford to do business under the new rules. Cristina Quinn has more.
At the Wollaston Child Care Center in Quincy, decorations from March are still on the wall, marking the last time anyone was in here.
We'll have fewer chairs at each table.
And when children return on June 29th, Administrative Director Patty Wilson says things will look and feel different.
Each child will probably have their own personal collection of art supplies, their glue, their crayons, scissors.
No more playing with stuffed animals or dress up, and there will be a lot more hand washing and sanitizing, and of course, masks for kids. But how do you get toddlers to practice social distancing?
Our best bet is going to be to try to attract them to disperse to different areas of the classroom for the staff members. And we've got a really great teaching staff here to encourage them, to be a part.
Right. Create a diversion.
Right.
Yeah.
And honestly, I can't say realistically they're never going to touch each other. I can't put them all in bubbles.
But kids have to stay in the same room all day. No commingling. The same goes for staff.
That's going to be one of the most challenging aspects of the new regulations for a number of reasons. Each classroom needs to have 2 teachers and only those 2 teachers.
The whole day.
The whole day.
But the biggest challenge for daycare operators may be financial. Under the state's reopening plan, childcare centers can only allow a maximum of 10 children per classroom. Pre-COVID-19, these classrooms could hold twice that many. You need more teachers, more staff, fewer kids, and also more supplies.
Exactly.
More than 34,000 daycare operators have signed a Change.org petition saying the new rules will cripple their businesses. They also say the guidelines are impossible to follow properly and will instill fear and anxiety in children. Given all the changes, Wilson says it's not yet clear how many kids will return, but Titilayo Westover's son will definitely be one of them.
We were ready to return. We'll be here the first day it opens.
Westover, who's a nurse, has been juggling care for her nearly 2-year-old son, Kaio, with her husband, who's been working from home. She says the benefits of being back at daycare for her family will outweigh the adjustments to the new changes.
He understands that he's not seeing his friends. He's understanding that his whole routine is now not the normal it used to be. So returning him will provide a sense of normalcy for him.
A new normal where life at daycare, like everywhere else, is sure to look different. Cristina Quinn, WGBH News.
Patty Wilson is hopeful that the Wollaston Child Care Center will get some financial help from the state. At the federal level, the HEROES Act, which would provide some relief for child care providers, has passed in the House, but the Senate has yet to act.